The North Korean Ministry of Public Health has confirmed that more than 81,000 North Koreans contracted influenza A and that 4 died from the illness between December and mid-January, an international humanitarian agency said in a report last week. The International Federation of Red Cross and Red Crescent Societies (IFRC) issued its report on a local outbreak of influenza A H1N1 on January 26. A total of 81,640 individuals were reported to be suffering from influenza A by the DPRK Vice Minister of Public Health, who officially confirmed the news to the World Health Organization WHO country office in Pyongyang on January 19. North Korean health authorities found 126,574 suspected cases of H1N1 influenza between the 1st of December and the 16th of January. Out of the cases, 66,706 to 52.7% were over the age of 17. 24.5% and 22.8% of suspected infectees were children aged between 0 and 7 years and 8 and 16 years respectively. The IFRC said that while the outbreak has become generalized throughout the country, 28.7% of cases had taken place in Pyongyang. The North Korean government has asked for support with influenza vaccination targeting high-risk individuals, while the Ministry of Public Health has reportedly specifically requested the WHO supply healthcare workers with 30,000 Oseltamivir tablets. WHO has so far dispatched 5,000 tablets with 30,000 in the pipeline to distribute to frontline healthcare workers and vulnerable groups, the IFRC said in the written statement. Oseltamivir, an antiviral drug, is usually on sale under the brand name of Tamiflu. The DPRK health authorities have also requested the WHO and the UN Children's Fund UNICEF provide support with conducting an effective communication program, while emphasizing public health including surveillance and preventive activities. The Rodong Sinmun, an organ of the Workers' Party of Korea (WPK), on Sunday reported that a new flu type H3N2 has been spreading globally. In the article published under the name of Pak Myong-soo, director of the National Hygienic Inspection Agency. It is crucial to know common sense of the new flu well and take preventive measures to thoroughly prevent the new type flu in advance, the Rodong said, suggesting several means of prevention. Despite the organ saying emergency quarantine measures have been taken to thoroughly prevent the new type flu in the country, there is no mention in the article of the 81,640 already affected in the country. Relevant organizations, including the National Hygienic Inspection Agency of the Ministry of Public Health, have reportedly been conducting inspections and quarantining more strictly at entry points including airports, ports, and stations on the border. South Korea's Ministry of Unification MOU on Monday said the government has been continuously monitoring the trend of influenza A in the north. We will make full preparation for quarantine in a more thorough manner with regard to the visit of the North Koreans to the south and our side's visit to the north, Baek Tae-hyun, spokesperson of Unification Ministry, told assembled media during a regular briefing. The last comparable outbreak in the DPRK came in December 2009, when state media admitted that the new influenza A H1N1 virus had broken out in some areas, amid the growing number of its victims worldwide. The South Korean government in February the following year sent 200,000 liters of hand sanitizer, worth 1 billion Korean won, to the DPRK to help the country combat H1N1 influenza. The goods were transported by 27 South Korean officials. Seoul also sent North Korea hundreds of thousands of Tamiflu and Relenza antiviral pills to help contain the spread of swine flu in December 2009. The WHO is yet to grade the outbreak of influenza A in the north on its humanitarian emergency grade scale, a delay the IFRC said is due to the lack of epidemiological information provided by the DPRK Ministry of Public Health. The UN Health Agency requires, according to the IFRC, information including the age breakdown of suspected and confirmed cases, the number of pregnant women affected and confirmation of the type of influenza. In its report, the IFRC said the DPRK Red Cross Society and the Ministry of Public Health are holding daily meetings to coordinate activities and better understand the needs and gaps. Edited by Oliver Hutham. Featured image, UNICEF.